The war in Gaza has left an indelible mark, a landscape scarred and countless lives lost. Amidst the ruins, the quest for an accurate account of the human cost continues. Recently, the Gaza Health Ministry announced a significant revision to the death toll, removing 1,852 names from its list. This adjustment, bringing the official count down to 50,609, has sent ripples through the global community, prompting a reassessment of the conflict's devastating impact. The revised figures underscore the complexities of data collection during wartime, where chaos and uncertainty reign supreme. The initial death toll, a staggering figure that shocked the world, was a testament to the brutality of the conflict. Now, with this revision, a new layer of complexity has been added to the narrative. The reasons behind the removal of these names are multifaceted, ranging from deaths attributed to natural causes to clerical errors and even potential false claims. This revelation compels us to delve deeper, to understand the factors at play and the implications of this revised count. In the fog of war, information is often fragmented, unreliable, and difficult to verify. The chaos of conflict creates an environment where accurate data collection becomes a Herculean task. The sheer scale of destruction, the breakdown of infrastructure, and the displacement of populations all contribute to the difficulty in obtaining a clear picture of the human cost. Amidst this chaos, the Gaza Health Ministry faced immense challenges in compiling an accurate list of casualties. The initial reliance on an online form for reporting missing bodies, while intended to expedite the process, ultimately introduced a degree of uncertainty. This system, implemented in the immediate aftermath of the conflict, allowed for the submission of names without requiring immediate judicial confirmation. While well-intentioned, this approach left the door open for potential errors and inconsistencies. The sheer volume of submissions, coupled with the lack of immediate verification, created a situation where the death toll could be inflated. This is not to say that there was any deliberate attempt to mislead, rather, it highlights the challenges inherent in collecting reliable data in a war-torn environment. The decision to remove 1,852 names from the Gaza death toll list was not taken lightly. It was the result of a meticulous review process undertaken by the Gaza Health Ministry, aiming to ensure the accuracy and reliability of their records. This revision was driven by a multifaceted analysis of the data, which revealed several key reasons for the initial discrepancies. Firstly, a significant number of removals were attributed to deaths caused by natural causes, albeit within the context of the war. These deaths, while not directly resulting from violence, were nonetheless linked to the dire conditions created by the conflict. Individuals with pre-existing health conditions, for instance, may have succumbed to their illnesses due to lack of access to medication or adequate healthcare facilities. Secondly, a portion of the removals stemmed from clerical errors, a regrettable but understandable consequence of the pressure and chaos surrounding data collection during wartime. These errors, while unintentional, highlight the importance of robust verification mechanisms, particularly in such sensitive situations. The fog of war obscures more than just immediate casualties. It casts a long shadow, impacting the lives and well-being of those who survived the initial onslaught. The removal of names attributed to natural causes from the Gaza death toll list underscores this often overlooked aspect of conflict. While these individuals may not have perished from direct violence, their deaths were nonetheless tragically intertwined with the war's devastating consequences. The siege on Gaza, which severely restricted the flow of essential goods, medicine, and medical supplies, created a dire humanitarian crisis. Hospitals, already ill-equipped to handle the influx of war wounded, were stretched beyond capacity. This meant that even those with treatable conditions faced immense challenges in accessing timely and adequate healthcare. Individuals with chronic illnesses such as heart disease or diabetes found themselves deprived of essential medications, exacerbating their conditions and increasing their vulnerability. The collapse of basic infrastructure, including sanitation and clean water systems, further compounded the health risks. The spread of waterborne diseases became a pressing concern, particularly for the most vulnerable populations: children, the elderly, and those with compromised immune systems. Section 5. Clerical errors, human fallibility in times of crisis. The fog of war often descends upon the most meticulous record-keeping, blurring lines, and introducing an element of human error even in the most well-intentioned efforts. The recent revision of the Gaza death toll, which saw the removal of names due to clerical errors, serves as a poignant reminder of this inherent fallibility. While regrettable, these errors highlight the extraordinary pressures faced by those tasked with documenting casualties amidst the chaos and devastation of conflict. In the immediate aftermath of the war, with communication networks disrupted and hospitals overwhelmed, creating an accurate record of the deceased presented a monumental challenge. The sheer volume of casualties, coupled with the lack of centralized information and the urgency of the situation, increased the likelihood of mistakes. Names may have been duplicated, misspelled, or misidentified. The fog of war often leads to confusion, with conflicting reports, missing information, and the fog of trauma impacting even the most dedicated individuals. Section 6. False claims, exploiting tragedy for personal gain. While the majority of the removals from the Gaza death toll list were attributed to natural causes and clerical errors, a small fraction raised concerns about potential false claims. This revelation, though unsettling, underscores the complexities of operating within a conflict zone, where desperation and opportunism can sadly intertwine. The promise of financial aid, intended to provide a lifeline to those who lost loved ones and suffered immense losses, may have, in some instances, become a perverse incentive. Individuals driven by desperation and fueled by rumors of compensation may have submitted false claims hoping to secure much-needed assistance. This is not to diminish the suffering of the vast majority who endured unimaginable loss, but rather a stark reminder that even in the darkest of times, opportunism can cast a long shadow. Section 7. The aftermath, trust and transparency in question. The revelation of the revised death toll in Gaza has reverberated far beyond the conflict zone, raising critical questions about trust and transparency in reporting casualties of war. This adjustment, while necessary to ensure accuracy, has inadvertently fueled skepticism and cast a shadow of doubt on the initial figures. The lack of clarity surrounding the initial data collection process, particularly the reliance on an unverified online form, has contributed to this erosion of trust. While the Gaza Health Ministry has maintained that these submissions were always considered provisional, this caveat was not widely understood or communicated effectively. This lack of transparency, whether intentional or unintentional, has created an information vacuum, allowing for speculation and mistrust to take root. This incident underscores the paramount importance of clear communication, robust verification mechanisms, and independent oversight when collecting and disseminating sensitive data in conflict zones. Section 8. A call for accuracy, the importance of verified data. The fog of war often obscures the truth, making it challenging to discern fact from fiction. In this environment, accurate and reliable data becomes even more critical, serving as a beacon of light amidst the chaos. The recent revision of the Gaza death toll highlights the paramount importance of verified data in understanding the true cost of conflict and holding those responsible accountable. While errors and inconsistencies can occur even with the most rigorous systems in place, striving for accuracy must remain paramount. This requires a multi-pronged approach, encompassing transparent data collection methods, independent verification mechanisms, and a commitment to correcting errors promptly and openly. The international community, too, has a crucial role to play in supporting efforts to enhance data reliability. This includes providing technical assistance, promoting best practices, and advocating for unhindered access for humanitarian organizations and independent observers. Section 9. Moving forward. Lessons learned and the path ahead. The revision of the Gaza death toll, while unsettling, offers an opportunity for reflection and a call to action. It underscores the need for greater transparency, accountability, and a steadfast commitment to accuracy in documenting the human cost of conflict. Moving forward, it is essential to learn from this experience and implement measures to prevent similar discrepancies in the future. The Gaza Health Ministry, for its part, has acknowledged the shortcomings of its initial data collection process and has taken steps to enhance its verification mechanisms. The reliance on an unverified online form has been replaced by a more rigorous system that prioritizes judicial confirmation before adding names to the official list. This commitment to improvement is commendable, but sustained efforts are needed to rebuild trust and ensure the accuracy of future casualty figures. This includes investing in robust data management systems, fostering collaboration with international organizations, and promoting open communication with the public.
Thanks for watching, and please remember to like, subscribe and share this video to stay updated with the latest breaking news from DesBuzz 24.